and down, going underneath the gum tissue. Very good. Now stay down there and go up over the gum tissue and do the other tooth that you're in between, up and down. Good that you're not doing any seesaws.
Okay.
Very nice. Okay, that's probably enough demonstration. I'll take your floss.
Okay.
And why don't we're gonna see the plaque in your mouth first, so we can kind of see, you brushed today, I'm assuming. So, and you probably tried to do a really good job. She didn't really, so we could find some things. And so I'm gonna have you take a disclosing tablet, chew it up really good, spit it out, then rinse, and then we'll show up where you might be missing some more plaque. I know we talked a little bit about it earlier, but this will really show us. Okay, if you want to grab that toothbrush, and we're going to look. I didn't wait long enough. These white coats have seen better days, haven't they? Any questions so far?
I don't think so. I don't like to, I'm kind of on the go a lot, so I don't know that I spend very much time on my teeth.
It does take time to remove the plaque and the bacteria, more importantly. So can you see in this mirror, maybe I'll bring this down a little bit
Yeah,
further.
that's good.
Okay, let's get the lights.
Yeah, now I can.
See good, okay. Okay, so one area that we had kind of talked about before, and the floss and the brushing will help, but right in between, and by seeing that floss around, that will help that area a lot. And let's look on the inside before we get going. You can kind of see at the gum line there. Can you see back there where you're missing? Right, and that's where most people miss. Okay, this side looks better. There is still a little bit. Can you see that where you're missing? Okay, all right. Let's try to brush that off first off.
Okay.
And remember the 45-degree angle. Okay. That will remove some, but let's try this technique where we do what we did on the model. 45-degree angle, the jiggles, and then sweep up. How's that feel?
I can tell it's tingly in there.
Probably there might be a little beginning of the gingivitis, the gum disease, because of the plaque that's there. And it's just getting that area. It probably makes your tissue feel good. Overlap, that's good. Let's take the brush down a little bit more there, and let's angle a little bit more. Okay. And do you remember what we said to do in this area by the tongue?
I did.
Okay, let's move the toothbrush in a vertical. Remember that?
Yeah, that's really good.
Okay. Okay, very nice. Okay, so let's streamline this just from the fake for the sake of getting through flossing. Do you have any questions about that and how it felt? And
Yeah, it feels good.
okay, and do you think you can try to accomplish that twice a day? Soft toothbrush. Do we talk about how much time to spend?
I don't think so. I don't remember that.
About 3 minutes each time. Listen to a song, get an egg timer. It seems like that's not a lot of time, but it is, you know, when you're spending it brushing your teeth. What do you do after you brush your teeth?
I usually just put it in a holder, one of those toothbrush holders on the sink, everybody else's, and much just, I'm done for the day.
Well, it's a good idea. That's okay, but it's kind of nice to have its own space where it's not touching other brushes. You do want it to dry out. We want to rinse it, let it dry out, and we want to keep it further away from the toilet area because there's aerosols that are produced, and we don't want to crossbreed any germs if possible. One thing that we didn't talk about besides the brushing and flossing, and I will have you show me how to floss in a moment, but what about your tongue? Do you ever brush that at all?
Kind of gags me when I do that, chokes
Okay.
me.
The more you do that, like anything else, that gag reflex will improve, but it's really important to brush the tongue back and forth as well to remove bacteria and plaque.
You just brush it like this?
You go back a lot further, so stick your tongue out, and yes.
Huh.
Or
I do it every
you
day?
can, or you can brush forward like that, if that feels better,
Okay.
okay? Let's try flossing, and I think you've got a clean little floss there.
Okay. I floss like this because I think that if I do 2 at a time, I get the job done a lot easier.
Well, you are a very productive and efficient person, but, but
It's hard to get in the back though, because then it looks like
It
then
is.
that cuts your corners of your mouth.
And that technique is not as effective in removing the plaque. So I get where you're coming from, but let's try the
Double it
technique
up before.
that we did earlier. When you guys are doing this on each other, you don't have to be as difficult a patient as she is now. I'm kidding. But I mean, we do need to get through it in a certain amount of time. But just, you don't have to be ornery, or, you can listen, throw in a few things, so anything's good. Okay, one thing right off the bat, I think we need to take up more floss on our fingers. I think we're working with a little bit. Okay, so and then by pointing your fingers there and keeping that little area stiff, I think you're gonna be able to control it a little bit better. Do you need to, is this mirror, can you see?
I think I need to see that.
Okay,
Yeah.
is that good now? Okay.
Yeah, I can see. Okay.
Let's do a front tooth, so we'll get the hang of it. Seesaw, back and forth. Now, once you're there, let's wrap it as much as we can. That's good. Wrap and go underneath that tissue gently. Now, let's wrap it on the other side, being careful not to hurt our gum tissue that's there. Let's go a little bit deeper. You might want to get a little bit closer if you can. Yes, so that you can control it. That looks great. Let's do one on the bottom. Seesaw down, and let's try to wrap it with, yes, you corrected yourself. Go down, seesaw, very nice. Under the tissue until it really feels squeaky clean. Let's try back tooth. It's more
hard.
difficult. Let out more floss, let out a little bit more floss, okay? And then kind of slide your fingers so you still got a controllable little area to work with. Now seesaw down and go backwards. That's good. Are you going underneath the gum tissue? Maybe on this side, see it back a little bit further. Okay, good. Wrapping it around the pointer finger is probably not a really good
It
idea.
felt kind of awkward.
Yeah. Okay, let's try to go forward and do the tooth where the crown is. Up and down, up and down. You got the right idea.
Uh-huh.
That looks good.
Uh-huh.
One thing
I'm
about
on it.
flossing, in the beginning, you're probably you possibly could bleed for a while. It may feel a little bit uncomfortable. That's okay. Kind of just trudge through and keep working on it, because the more you do it, it really is going to get easy. I don't want to minimize. I know this is difficult to do, to take the time to do it correctly. At home, you might want to get in front of a makeup mirror or a magnifier. Will help you immensely with the flossing part of it. Any questions? Anything else?
Is it that important that I really have to get off the plaque? What's the reason why I really have to get it off?
Great question. What would matter to you why it's so important to get the plaque off?
I think maybe just because my teeth look good when I get it off.
Definitely.
They don't look gross.
Brighter smile. How about breath?
Yeah, socially, I guess that would be good. So I have to keep my friends.
Would you like to save a little money and not have additional work done?
Yeah, it's expensive.
Anything else? Did I forget anything?
Time, I guess it would make sense that if I clean my teeth, I wouldn't have to come off, and so it would save time and money.
Definitely.
And is that true about all that stuff that they say that your teeth connect to your body and help them?
Oh, definitely. They're finding that the bacteria in the plaque, if it's integrating into the gum tissue and it's spreading throughout the body systemically, so there definitely is a relation to disease in the mouth and possible connections to disease elsewhere in the body. So definitely, just get rid of it. Just get rid of it. Is there anything else?
I can't think of anything else.
Hey ladies, maybe you know, you're probably looking at your PE, so is there anything that, did we talk about the reasons, times per day, best time of day? I think we talked about morning and night, maybe not, you want to stress that. We talked about soft toothbrush, occlusal brushing, which is in the second box on the bottom, the angulation, getting the bristles into the sulcus. She demonstrated both on the model and then in her mouth. Our reasons, the relevance of plaque to the disease and how they're different, caries and periodontal disease. I think that's it. Is there anything that I missed, Mrs. Snell, or that questions you have?
I think you guys, when you touch on tongue cleaning, you could tell them that the tongue has a rough surface. It's kind of got filaments in it, and food and plaque gets embedded in it, so you won't have fresh breath unless you do clean that every day, like you're brushing and flossing. You could tell them you could brush it, show the patient, because a lot of times they do gag, and they have tongue scrapers, but they can use a tongue cleaner. It's a little plastic device that can also use to clean their tongue, but clean it at least once a day also. And